A very good afternoon, everyone. I welcome you all to the afternoon session. Now we will start with a session of 1 week faculty development program on mental health and AI, innovation in detection, treatment and support, which was organized by AIU Chitkara University, Himachal Pradesh, Academic and Administrative Development Center in association with IQAC, Chitkara University, Himachal Pradesh. It's really wonderful to see you all back. So as we move forward, let's take a moment to recap the key highlights from day 2 in morning of our faculty development program, which was based on AI tools for analysis of post-marketing data of drugs for mental health. The session began with an in-depth discussion led by Dr. Anup Kumar. Sir discussed about the detailed explanation of meta-analysis, including the steps involved, and the insights were significant as he also discussed about SLR, that is systemic literature review, and meta-analysis process using a lot of tools which is based on AI like graphical abstract maker, AI tools for research such as Scite and Gen. So I hope you all have had your answers for the questions given to you in the WhatsApp group. So now I request the participants to please share your answers with us. So over to the participants now. I request the participants to share the answers for same. The questions are already on your screens now. Anyone from the participants? So we have given 4 questions to you all. Number 1 question is, what are the different steps in meta-analysis, which was discussed by Dr. Anu? Second is, what types of post-marketing data are commonly analyzed to assess the effectiveness and safety of drug used in mental health treatments? Third question is, discuss AI tools used to process systemic review and meta-analysis. And the last question is, discuss limitations of AI tools used to process systemic review and meta-analysis. So anyone from participant can share their answer for any one question also. It's not compulsory that you have to answer all 4 questions.
Hello, hi ma'am.
Hello, ma'am.
Ma'am, I just want to answer the first question, different steps in meta-analysis. So the step includes in meta-analysis identification, selection, abstraction, and analysis. Identification, in which the author of meta-analysis has assembled a large number of study because it is important to select the right one for the selection. And for the selection, we have to go to the multiple studies, and we have selected some numerous studies in which we will get the inclusion and exclusion criteria. Other one is the abstraction. Once the appropriate group of studies has been identified, the author have to abstract the relevant data from each study for their meta-analysis. And after that, the analysis has been done of the meta-analytic data, like homogeneity and heterogeneity. As Anup sir discussed, heterogeneity describe the degree of difference between the variability of different group of studies. So this will comes into the analysis part.
Thank you so much, ma'am. Next participant. So I just want to remind all of you that your participation, it is also counted. So I request you to please share the answer.
Hello, ma'am. from the first question, the different steps in the meta-analysis. The first, we set up the questions, and the second step is to find the studies, identify the all relevant studies, and evaluate. And the third steps, the evaluate the studies and quality of the study, determine which include and excludes, and then extract the data, collect data from the different studies, and uh, next calculate the statistics, and then draw the conclusion from the studies. Thank you.
Thank you, sir. Anyone else want to share their answer?
Hi, ma'am.
There were, yes, ma'am.
Yes, ma'am. My answer for third question is there are different AI tools we can use for the systemic review and meta-analysis, which includes the chat PDF, citation chaser, Covidence, Distiller SR, elect.org, Evidence Hunt, graphical abstract maker, and the Lit Suggest. And ChatGPT is a very common AI tool which we generally used for the writing review paper or review manuscript. And scholars is search smart, as well as wiseone.io is other one AI tool which we can use for the systemic review and the meta-analysis.
Thank you, ma'am. So there were few instructions in the beginning. So we will be giving best participant award. For that, you have to answer the questions, you have to attempt the poll and quizzes. So it's just a reminder that those who were active in day one and in the morning, so please continue that. Otherwise, you will lose a very good opportunity. I request the participants to please answer the question.
Good afternoon, ma'am.
Good afternoon.
May I answer the last question?
Yes, sir, please.
Am I audible?
Yes, sir.
Okay, so the last question is about the limitations of AI tools used to process systematic review and meta-analysis. So, systematic review, the first hurdle in the AI tools. So, they having limited databases. So, recent databases, they are lacking. So their databases are not updated. This is the first one. So whenever we try or we try to generate some systematic review, so they simply tell that we have no any update of certain dates or certain years. So this is the first major drawbacks or limitations of these AI tools, especially for Chat GPT. And secondly, so that systematic review is not comparatively studied, comparatively compared, or their results are so that is not a quality research. So this is the second hurdle. So third, we are not able to conclude. So what are the research gaps? So a research scholar or early researchers, so if we try some historical data or some any previous research, any topics, so there is not much help for such review. So the manual review having some analytical study, comparative study, and some qualitative and some conclusive results, so that we can use these reviews for the further research or the next research. So these are the limitations. And the meta-analysis. So the meta-analysis is the same. So that is the comparative study, and that comparison is always lacking, or suppose some research. So in the recent year, 2024 or 23, some research is going on. So they are not aware, and so if any research having no any recent information or recent based on research progress, so that is not valued in recent times. So I think these are the limitations in my opinion. Okay, thank you, ma'am.
Thank you so much, sir.
Good afternoon, ma'am.
Good afternoon, ma'am.
Am I audible?
Yes, ma'am, you are audible.
Okay, I want to add some points in question 4, limitations of AI tools. So limitations are there: accuracy, reliability, and the creditability of the result. This underscore the importance of human oversights and verification. AI system can also introduce the error in the process of data summarization. And given these tools are not capable of understanding context and underlying the meaning in the same way, these are the limitations. And other points are, I think, in some way, lack of understanding and the common sense, ethical and the moral decision also. That is the main limitations. And data dependency and the quality. According to me, these are the limitations of AI tools to process the systemic review and the meta-analysis. Thank you.
Thank you so much, ma'am.
Hi, ma'am. In my point of view, there is some limitations also we can add. There is a limited transfer learning, absence of creativity and originality, and there will be lack of understanding and the common sense. Basically, these are the basic limitation of AI tools, we can say. So thank you, ma'am.
Hello.
Thank you, ma'am.
No, today I don't have class with you, ma'am. No. That was changed, no?
Yes, anyone else want to share their answer?
Good afternoon, ma'am. I want to add few more points to fourth point, that limitation of AI tool in systematic review. So according to me, when we go for any systematic review, it requires a type of classification of data. That is the review papers, the research papers we collect. Then we need good classifier to classify our data. So here a good classifier and a good training algorithm is very crucial. And hyperparameter setting is also another point where we can improve the accuracy of our system. So if the training is not done properly and the sample size is not selected properly, then our AI algorithm will not produce the best result. So according to me, selection of sample size data and good classifier is also a challenging in SLR process.
Thank you so much, sir. Anyone else from the participant?
Hello, ma'am.
Yes, ma'am.
Can you give the answer of first question? Different steps in the meta-analysis.
Okay.
Can you hear me properly?
Yes, ma'am, you're audible.
Yeah, so first steps in the meta-analysis, we have to formulate our research question and we have to identify our studies. Then we have to determine the eligibility studies. We have to add inclusion, which want to keep inclusion as well as exclusion. Then third point, we have to extract some data from our studies. After extraction of the data, we have to analyze the data in the studies by statistical methods. And the last one, we have to subgroup and we have to sensitivity analysis. So these are the 5 steps which are included in the meta-analysis.
Thank you so much, ma'am.
Okay, thank you, ma'am.
Okay, I think that's it for today. So as we move forward, it is my honor and privilege to introduce our next speaker, Mr. Hitesh Garg, Vice President and India Managing Director for NXP Semiconductors. Sir holds a bachelor's degree in electronics and communication, along with a postgraduate degree in management from IIM Bangalore. He oversees NXP's operations across India, managing key sites in Noida, Bangalore, Hyderabad, and Pune. Alongside his leadership roles, Sir also serves as the R&D leader for the AMS Competence Center at NXP, where he drives the development and advanced analog RF, IPs, and subsystems for NXP products. With a career spanning over 25 years in analog mixed signal product development, he has led teams both in India and the Netherlands, focusing on innovation in security and connectivity, advanced driver assistance system, in-vehicle networking, and smart car access. Before joining NXP, he held various technical and leadership positions at Connexent System, Microchip, and Semiconductor Complex Limited. And today, we are truly honored to have him share his insight with us. So over to you, sir. I invite you on the virtual stage, and we are truly grateful to have you with us.
Thank you very much. Am I audible?
Yes, sir, you're audible.
Okay, thank you. So give me a minute. I'll try to share my my presentation and then we can start. Please let me know if my screen is visible.
Yes, sir, your screen is visible.
Okay, but I think there is something that I need to still do.
Yes, sir, I request you to put it in presentation mode.
Okay. Is it visible
Yes,
now?
it is visible now. Thank you so much.
Fantastic. So very good afternoon to all of you, and thank you very much for inviting me to this, I would say, this week-long, I would say, discussions on AI and healthcare. At least I have a long association with the Chitkara University. You can see there is a board, so where we inaugurated NXP lab. I think that was 12 years back. So in this university, so I personally have a very good connection with the university, and also I would say with faculty. I know Dr. Rajneesh for many years. So from that angle, it's like that I'm presenting to my own friends. So it's a positive feeling. At the same time, I think my topic is not exactly what the theme of this whole thing is, of the whole week is. I am kind of giving you a bit of a perspective on what's happening in the healthcare and what NXP as a company, right? So how are we looking at healthcare and how we are building solutions in healthcare. And so I think I will take another maybe 20-30 minutes for my presentation. So there'll be an opportunity for all of you to ask questions. So I think just moving on to my presentation. I think this is one second. I think the world around us is changing continuously, is changing very fast. So and these are the innovation drivers that we see around us. So there is the resilient and efficient factories. Of course, we talk about supply chain continuity. We talk about infrastructure updates. We talk about AI. We talk about demographic change. We talk about where people are trying to stay connected and sensing, and also climate change. So these are the things which are kind of driving us to innovate further, to innovate continuously. But I think these things are not changing, although the world is changing very fast. These innovation drivers are more or less stable for last 3-5, or I would say will also stay stable for next 5 years. So which is also very nice, because then at least we see a continuity. And so this also helps us that how we build our solutions. And if I move further, right, so I'm working, or at least NXP is a company in semiconductors. And if I look at the overall global semiconductor market, we will be $1.2 trillion market by 2030. Now the question is where we are in 2023, 2024. We are almost in the range of 650, 670. So in that range, so it means that we will double, the market will double in next 6 years. So that means there is more need for electronics engineers. There's more need for system engineers. There is more need for people who are using these semiconductors to build the next generation systems. And if you see in this graph, so you can easily identify there are 3 waves. If I say first wave, that was in 2000 to 2010. That's one, the semiconductor drivers for semiconductor industry were laptop, desktops, gaming console, home audio, video, and those kind of things. And also basic mobiles. Around 2010 to 2020, I think the era was more for smartphones, tablet, and data center servers. So that was, we call it as a second wave, and that drove semiconductor industry from, you can say, a 200 or 300 billion dollar to a 500-600 billion dollar industry. And now we are talking about, we are in this era of 2020 to 2030. And here we talk about artificial intelligence, from cloud to edge, smart connected devices, smart factories and home, and smart connected cars. And here AI from cloud to secure edge is going to drive the market further. There can be various applications, there can be various areas. For example, if you see 5G, smart homes, smart cars, smart industries, smart factories, I think these are the applications areas, and also healthcare is one of the key area which will which AI will drive more and more growth for semiconductor industry. And one of the key point which I would like to make here is semiconductor industry is an enabler. So if we talk about ESDM sector, which is electronics, so design manufacturing, the overall system, that is 5x more than this number. If it is 1.2 trillion, so that overall ESDM sector will be in the range of $6 trillion. So there is much more value that can be tapped into the ESDM ecosystem. And if I just bring back to India, I think India will have a share of around 10% of this 1.2 trillion market. So we will be consuming 120 billion dollars of semiconductor by 2030, and the ESDM sector in India will be around 500 to 600 billion dollar. And this statement was made by Prime Minister Modi in the Semicon India. So these are the figures which government is tracking, and these days I think government is all about figures, data, and everything. So at least they have these real targets, and which is good, because unless you have a target, you don't know what you are chasing. So just coming back to my point, I think AI is one of the biggest growth drivers for the industry going forward in this year. And AI is not only AI that we talk about your for example, ChatGPT and those kind of things. AI, when we talk about, it's AI on the edge, from cloud to secure edge. So end to end, how that is going to be. And in every sector, as I see, so we are getting digital twins. So we talk about industrial, we talk about smart home, we talk about automotive or healthcare. So there is a trend that the data from all these either industries or smart homes or healthcare, that is going to be stored in the clouds. So whatever your physical form is in the factory, so you will see a digital twin in the cloud. If you are driving a car, the car will have a digital twin in the cloud, and that whatever the car is going to experience on the road, it's going to share and store everything in the cloud. The learning of our cars is happening from all the data that is stored in the cloud, and from there they synthesize the data and do keep learning. So same thing is happening in healthcare. So we talk about remote diagnosis, we talk about advanced diagnosis. So there are, so I think machine learning algorithms for healthcare to detect the disease, to find out the right diagnosis for what we have. And that's where, when things are in the cloud, we can compare notes. So I think these are the trends that we see in front of us. So on one side, we see, okay, the solutions are becoming similar. These are very, very vast and different kind of application areas, but the solutions look to be similar. Yes, these solutions are similar. At the same time, the needs from the technology side are also a bit different, right? When we talk about home, I think the most important thing, what you see, is the system security. You don't want somebody is coming and barging in your home. So security is one of the key constraint when you talk about your home automation. For transportation, I think, of course, AI ML is everywhere, but when we talk about AI ML, so there is also real-time processing which is required. When you are driving a car at a 200 km/h speed, so the car is sensing the environment, at the same time the real-time processing. It has to, if there's an object on the road, the car has to brake instantaneously. So everything, the data, every processing has to be real-time. So that's what the transportation industry is putting. if you talk about healthcare, if you talk about smart cities, if you talk about smart industries, so there the key criteria, apart from other criteria, is also functional safety, right? So are your devices, so if there is a glucometer that you have, or if there is uh, a hearing aid, right? Are these devices functionally safe? So there are stringent requirements, there are stringent norms set for each and every industry, how the functional safety is considered. So even from the health guidelines, there are, if we are using electronics into either detection or diagnosis or any part of these, so there has to be stringent, so the devices has to adhere to the stringent guidelines which are put up by the approval agencies. And same thing, I would say, when we talk about personal devices, right? So they're also, I think, ultra low power. You want your cell phone batteries to run forever. You want the tablet batteries to go forever. Same thing if there is a coin cell detection, right? If there is a hearing aid, so hearing aid battery, if it just lasts for 5 days, I think it's not usable, or it just lasts for a day, it's not usable. So the solutions has to be ultra low power. So I think these are so although the technologies look the same, but the requirements from the overall technologies are also different. Functionally safe, ultra low power, system security, real time, and it's not easy to implement, right? So maybe if in your mobile application, you need not to have a real time kind of an application. It's okay if the processing is giving you the data, so there is some delay and those kind of things. So I think, so this is how we see it, and this is how we use to cook our technologies, how we cook technologies. And these are the technology vectors that I have in front of you, this is how we at NXP look at our technology. So we divide, like we try to segregate it like humans do. So we have sense technologies, we have technologies around thinking, connect, and act. So how can everything be aware? Thinking means everything smart, connected, of course, everything connected. And actuation technology means how can we make everything efficient? And underlying theme is everything should be safe and secure. And also implementation, we should have scalable system solutions, right? It is not like that if you have a solution, it works only in one geography, it only works on one temperature, or it works only in certain conditions. So whatever the solutions that you create, whatever implementations that you create, right, they should be scalable. It is not that the charger that we have is only working in in one city in Italy, right? And it's not possible to have that. So I think, so that's the requirement that we put from our technology vectors. And I think if we kind of conclude this, or at least if we take this further, so on sensing, for sure, there are various technologies that we have come up for. So we are number one, NXP is number one in automotive radar vision, face gesture recognition, voice recognition, motion, speed, pressure sensor, broadcast reception. And then on thinking side, we have all kind of processors. We have low end, I would say, microcontrollers, which is 8-bit, 16-bit microcontroller, to very, I would say, advanced high level vehicle brain kind of microprocessors, which are, again, which can also, you can say, intermingle with each other, scalable solutions, secure OTA updates are possible, and they are fully functionally safe with the highest SLD kind of safety standards. And in between, you see everything: high performance 3D graphics, layer space, which is high speed Ethernet, and those kind of solutions. Same on connectivity, we have plethora of connectivity technologies, be it on 5G, be it on Bluetooth, vehicle to vehicle communication, or MyFair, eSIM. Then ultra wideband is one of the key technology that we have for IoT, Zigbee, Wi-Fi, and NFC. Of course, we were pioneers of NFC, near field communication. So I think we have complete breadth of connectivity technologies. And then actuation, of course, battery management, power management in vehicle networks, high performance analog and general purpose analog. So this is how we cook our technologies. And the whole idea is then, so the applications can be in any of these areas using these connectivities. It can be in the healthcare, it can be in automotive, it can be in smart home, it can be in industrial. So I don't want to make a separate Bluetooth low energy chip for healthcare, which will not work for my smart home. So I think from that angle, at the same time, if I'm making you can say a neuron EIQ processor, which is AI ML brain, I think that I would like to use it in my smart industries at the same time in smart healthcare, right? So I think the applications can be very, very broad, but once we have the fundamentals of the technology, that how we cook our technology, how we bring those solutions, they can be utilized for any of these sectors. Now I'll just quickly dwell down into the I would say certain applications of the sensor technology into into medical or healthcare field, that what we have. So for example, here we are talking about a use case which is called hearing aid, earphone. So I think NXP has a best-in-class hearing aid solution. We have one of the biggest companies like PhoneX. So they are using the hearing aid solution. You see very, very advanced hearing aids with high dynamic range, more than 16-bit or 24-bit kind of dynamic range, with high sensitivity. I think those are all present in these hearing aid. One of the key feature that we have is, see, sometimes you don't want the RF waves to go through your brain. So we have come up with the magnetic induction kind of capabilities into. So if there is the sound which is coming to your right ear, so the sound will be magnetically coupled from right ear earphone to the left ear. So I think from that angle, it's fully functionally safe. It's fully safe for the humans. And these kind of technologies we also need to cook, which are, because the magnetic induction rays are going through your brain. And yeah, I think this is a unique technology that we have come up. Similarly, for smart inhalers, we are using our advanced sensing technologies for its smart inhalers. I think, as you see, right, end of the day, we have K30 MPU, which is 14 lead frame quad package with power supply, with battery, with the TIR sensor, with absolute pressure sensor. I think we are able to detect, or we are able to make the smart inhaler. This is a complete application block diagram of how a smart inhaler will look like. Also on the patient monitoring activity, right? So again, on one side, we are using our sensors, but at the same time also our microcontrollers, which are low power, also wireless connectivity here, if you see, plus touch sensing into patient monitoring activity, which some of these applications you already see in the real world in the hospitals. Also, things like sensor use cases for sleep checks. Okay, how are you, or sleep apnea? How are you doing that? So I think that also is enabled by this by some of the actuation technology. Here you see 3-phase gate driver. Here's a power management IC. So here's an MCU plus segment LCD controller, plus we have this pressure sensor, which will continue to monitor the pressures while somebody is sleeping. So and also this is one example where I have EIQ neutron MPU accelerator. So this is I would say our low power microcontroller, which has machine learning capabilities with 4 cores, as you see here, and also dequantization, scalar, activation engines, and a lot of also built-in DMA controllers. So I think this is an example of how we are using machine learning, and this NPU accelerator is actually mainly used in the medical devices. So I think we are, so that's where, if I go back to my talk, when I said, right, AI is not only, when we say AI and machine learning, not only what you do with the chat GPT. When you write something, I want this abstract, they will, or if you can give me answer of this question, so then you get it. So that's more, I would say, on the generative AI part, but this is more where we are using AI into our products, into our microprocessor, microcontrollers, and these are the small smart devices. And we will have 75 billions of these devices by 2030. And that's where AI has much more advantages to whatever we do every day in our life. One more example on the pharma side, right? So again, we have this NFC technology, which is again an example of connectivity technology, very, very low power. You don't need any power for NFC. It is there in every of your credit card. When you tap your credit card, the payment is done. It's a fully end-to-end security. And the same technology, I think we are also using for medication adherence, or authentication for certain medicines, or also like checking, or even for some glucometers and those kind of things. So I think we are, for variety use cases in healthcare, we are using our NFC technologies. So I think this again, also another connectivity technology is Bluetooth. And this is the controller subsystem. If you see this board, yeah, although it looks much bigger board, but I think this is one of the Bluetooth BTLE kind of application board, which is also, as I said, from the connectivity solution, we are using it into our healthcare, more and more of healthcare applications. So at the same time, I think we are also connecting with the ecosystem, with the startups, that how we can together drive the technologies for the future. And there is always a continuous invitation for the startups to connect with us, collaborate with us, so that we can together build the market. Because from NXP side, we are cooking the technologies. Somebody has to use these technologies to make either the products or applications or systems or subsystem, which will go into these kind of different applications that we see around us, right? And I would say we have a very successful program where for last 4 years, we have more than 40 startups who are connected with us through our startup programs. And this year we had actually 4 winners in I would say in last year, whatever contest that we had. And out of 4, I think 2 were into medical field. So there's a Muse Diagnostics, where focus on AI assisted healthcare screening. Again, market focus is smart health. And even last year, I know, so there is a doctor in Bangalore. Her name is Sugandhi Gopal. So she is using NXP technologies to make ECG much accurate. So basically, in general ECG, you measure a millivolt signal, but she is kind of detecting a microvolt signal to make it a unique, a colored ECG. And that is because she herself is a doctor. She's a cardiologist, and she knows all the intricacies, but she's also an entrepreneur, and she's building solutions for how do we do it. Very advanced, simple. There's a small strip. So you put that device on your chest, and the accurate ECG is taken. I think she's working on those things. So at least there are numerous kind of startups which are working on how do we create more and more smart devices for medical applications. At least NXP provides all the key technologies. So that's where I say I invite all of you, even the students from Chitkara universities, to come and play with NXP technologies. And here for playing with NXP technology, we have a Freedom board, which allows you to play with all our technology, be it on graphics, sensing, machine learning, touch, motor controller, connectivity, and voice. So these Freedom boards are available in case if you would like to procure them. And I think you can start playing and creating your own solutions. With this, yeah, I stop here and probably would like to know if there are any questions.
Thank you so much, sir. The session was truly very enlightening. Now, I request all the participants, if you have any questions, you can directly ask from the expert himself. Any questions from anyone?
Good afternoon, sir. This is Dr. Pradipta from CSC department. Sir, it was very informative session about the semiconductor devices and how we can apply this in healthcare sector. Sir, my question is that at present in India, we are not a hub of semiconductors. We are dependent on China for semiconductor, but we are going to manufacture in India. Am I right, sir?
I am. Can you please repeat your question, Dr. Pradipta?
Hello.
Or whosoever was. Can you hear me? Am I
Yes,
audible?
sir. Yes, sir.
Yeah. Can you please repeat your question? I did not capture it fully.
Okay. Sir, my question is, at present, we are importing semiconductors from China. Now we are going to manufacture in India, and the initiative is still on. So my question is, if we successfully manufacture the semiconductors in India, then how much it will impact the healthcare sector by reducing the prices of the smart devices?
Yeah, very good question. I think let me just take a moment to say that semiconductor is a very, very complex supply chain. So semiconductors are designed in Europe, in US, in India, and then I would say they are manufactured in a fabrication unit. And most of the fabrication units are not in China. They are in a country called Taiwan. So TSMC is one of the biggest factory which produces 80% of the semiconductor chips. And I would say their biggest factories are in Taiwan. China is having one or two foundries. It's called SSMC. But the semiconductor manufacturing, especially the chips, are made mostly in Taiwan. Of course, there are some foundries in US. For example, Intel has its own foundry. Then also there is a company called Samsung, and they have their foundries in Korea. So these are the only, I would say, majority of the two countries where they have semiconductor fabrication. Then once you fabricate, then these chips have to be tested and packaged. And those packaging facilities are mostly in Malaysia, Thailand, and now India is, and also of course in Europe and US, but now India is also trying to get some of those packaging we call ATMP units in India. And once this is tested and then packaged, and then these chips are sent wherever the application is. So China basically, so what they have been doing is for last many years is, although the chips are not produced in China, but they are, I would say, they are making a lot of system designs. For example, the reference boards. If you have to make a board for any application, say hearing aid, or if you talk about even automotive or mobile phone. So all the mobile phone system design, it is all done in China. Now, the people in China decide which chip will go into this mobile phone. And they will make a complete system. They will make a complete board and send it to rest of the world. So if you understand correctly, so now China is not making the chips, but they are making more and more of the modules. And that's where we see that China is producing those chips. But now I think that's where I say that Indian government has now a focus of not only building some fabs in India, but at the same time also having the ATMP and also the whole manufacturing. So Tata's, I was in Tata Group last week, where I met also the Tata chairman. I think they have acquired certain companies where they are making the iPhones in their own factory in Karnataka. So these kind of developments are happening. But at the same time, I think the fab in India, so there is one fab which has been announced. It will come after 4 years. While India's consumption is going to be $110 billion, that one fab will not make things completely different for us. So we still are dependent on other geographies, even if we have 1 or 2 fabs. But I think this is how the whole world was working. There was no problem. But I think we need to bring more and more system designers, more and more system integration to be done in India. I think that's a bigger pie. So if there is $100 billion of semiconductor manufacturing, which is chips, there is a $400 billion of ESDM sector. So overall making a $500 billion of a pie. Hope I could answer your question, but this is the perspective which I
Yes, I got my answer. Thank you so much, sir. Thank you so much.
Good afternoon, sir. So first of all, thank you for this informative session. So my question is, what sectors do you believe that they will see the most growth in semiconductor demand over the next decade?
Fantastic. Thank you very much, Dr. Sandhya, for your question. And I think this is a very, very nice question again, as you asked. So I think, as I said, the biggest growth will be on the secure edge. Artificial intelligence from cloud to edge. So we are going to have 75 billion connected devices. So the areas like, of course, you see there is we talk about autonomous cars. So all the, we also talk about software defined vehicles. So all the advancements in the car is dependent on electronics. So the Audis, the BMWs, and all the JLRs of this world, they are coming to NXP and they are asking, dear NXP, tell us how my car architecture will look like. So these guys are building the best in class cars, but they are coming to us and asking that how my car architecture will look like. So from that angle, I would say the similar questions are being asked by Meta guys, by industrial guys. So I think Industry 4.0 is a big growth driver. The smart homes is a big growth driver. Healthcare is one of the drivers, and automotive is another driver. So I think we will continue to serve the existing needs. For example, the 5G, 6G, and I think mobile will continue. But the new areas, industrial, automotive, smart home, healthcare, they have much bigger potential to take the industry to 1.2 or even beyond $1 trillion industry.
Thank you so much, sir. Thank you.
Good afternoon, sir. I am Vitika Sharma, the pre-final year student, and I have a doubt like what advancement in semiconductor technology have significantly impacted the healthcare applications?
Yeah. No, thank you, Vitika, for your question, and very nice question again. I think the biggest advancement is, for example, right, if you see, that's more in terms of diagnostics. Of course, see, healthcare is a very niche sector. So one of the things which we see is, and you might have heard those stories, right? Now, if you are having an Apple Watch, which is not a healthcare device, but your Apple Watch can do a perfect ECG, can do a very good ECG. And if there's a thing or there is a problem, then it also sets an alarm. And there are many instances that we have heard that people have been saved just because their Apple Watch triggered these things in the right time. So I think the health monitoring, we always say is prevention is better than a cure. So I think so the preventive measures that we are going to take either for a diabetic patient. So there are glucometer patches which you can put it on your body, or these kind of ECG tracking, or I would say, I think those preventive mechanisms are making us more and more aware, and that's a much bigger market. That's a much, I would say, better impact that I see. Apart from that, semiconductor is used in tracking, in, for example, advanced healthcare, all the, I would say, EEG, ECG, and all those advanced machines, they're all based on the semiconductor. But for me, if you ask me where the biggest advantage is in the preventive healthcare.
Hello. Good afternoon,
Yeah.
sir. Am I audible?
Yeah. Yes, Vaishali.
Okay. So which is the newest technology in medicine? Your pharma field.
I think I'm personally not aware of this because I am more from the semiconductor. I cannot answer that specific question. I think pharma is a different sector, but from the we come at least personally, my focus is more on electronics and cooking solutions, which can help in advanced diagnostics.
Okay, sir.
Right.
Sir,
Yeah.
one
So
more
from that
question.
angle, I think, yeah.
Yes, sir. Please continue. Please continue.
No, I think that was my answer. So I think I have shared, okay, what are the possible technologies? Now you are the guys who will cook how the solutions should look like based on the sensing, connect, and act technologies.
Sir, how the technology advancement is useful in the healthcare system?
Yeah, I think that's where I said that in healthcare you can track you can divide it into two parts. One, all the healthcare that you do at your home. So most of you, I think during COVID, we were having those devices which we used to put on our finger. It used to give how much is the blood oxygen level. Then a lot of, you see, everybody has in their homes where you have this blood pressure monitoring system. Then also, as I talked about, smart watches which checks your ECG. So also the glucometers. I think these are the advancements which I call preventive healthcare. Once you go to the hospital, of course, there are smart beds which will do a complete monitoring of you, and also advanced diagnostic solutions, advanced imaging solutions. So those are all available. But I would say more and more value is in the detection part. And with AI coupled smart devices, I think we can do much more with the same X-ray that you used to take if it is also trained by AI.
Okay, thank you so much, sir, for very informative and wonderful session. Thanks a lot.
Thank you so much, sir, for providing such valuable insight on the future scope of semiconductor in healthcare. Your discussion on the various applications was very informative, particularly the example you have given us about hearing aids, smart inhalers, and patient activity monitoring. And the potential of these semiconductors power devices will help patient to improve the healthcare, and the outcome will be impressive, I'm sure. So the session was incredibly insightful, and we are truly grateful to have had you with us today. And on behalf of everyone present, thank you for sharing your time, knowledge, and expertise with us. Your contribution has made an significant impact, and we are truly grateful for the opportunity to have you. Thank you so much, sir.
Thank you very much. It was also a pleasure, and please say my regards to Rajneesh sir and say my thank you to him. as well.
Sure, sir. Thank you so much, sir.
Thank you.
This concludes our session. Now I request all the participants to take the picture of these questions based on today's session. And we will be discussing these questions in the next session in the morning. The questions will be provided to you in the WhatsApp group also. So there are 3 questions based on today's session, which will be discussed in the morning session tomorrow. So now I request all the participants to attempt the poll and share their responses. Again, we have 2 questions in this poll also. So you all are requested to please attempt and share your answers.
Ma'am, can we leave after attempting the poll?
Yes, ma'am, you can leave. I once again request all the participants to please attempt the poll. Only 50% of the participants have attempted it. So now we are ending the poll. So the results are on the screen. So thank you, everyone. Thank you for being there. And I wish you all have a fruitful and enriching experience today also. So now we will meet tomorrow at 10 o'clock along with the answers. So the self-assessment questions which is provided to you all. So it is also a part where we are going to analyze the best participant. So all the participants are requested to come along with their answers and we will meet tomorrow. Thank you so much. So tomorrow is holiday, I'm so sorry. So we will meet on Monday. Thank you, everyone.